Actually, we started na, di ba? Then we stop lang from saan tayo nag-stop, guys?
Sa ano po, PIDSR po.
Okay, sa PIDSAR. Pero di pa tayo nag-start talaga ng community. Pero we finished discussing about the PIDSAR naman.
We finished discussing naman po.
Okay, sige. So, mag-start na talaga tayo ng ating nursing process. Okay, visible naman sa inyo yung slides, no? Alright. So, yung nursing process natin in the care of population groups and community. So, for sure, parang natanong ko ba kayo if done na kayo ng duty sa community? Have I asked you last night if you're done with duty?
Yes
Okay,
po.
sige. Okay. So, hindi lang tayo gumagawa ng NCP individually but as well as sa community, no? Tayo ay meron tayong mga nursing processes din in which ang focus natin dito is the population group and the community itself. Okay, okay, so yung um, the community and public health nurses, no, its aim is to improve the health status of the community in general. So yun naman ay na kumbaga na-determine na naman natin talaga kung ano ba talaga yung aim and purpose of course ng community health nursing as well as ng mga public health nurses, no? So kagaya lang din sa ibang fields ng nursing practice, care of the community is undertaken utilizing the nursing process, no? Of course, uh, in a cyclical scheme of assessment, of diagnosis, planning, intervention, and evaluation, simply as your ADPI, no? And sabi nga sa nurse, ang community ay it's not just about the setting or the context for providing community health nursing, no? Ang Yun talaga yung focus ng nursing care, okay? To the community health nurse, so it's understanding the meaning of community and understanding the meaning of community. It is a requisite, okay? So yung word community, sabi natin, 'di ba, madaming, kumbaga malawak ang scope niya and it has a varied meaning. World Health Organization defined community as groups of people that may or may not be spatially connected but who shares, no, common interests, concerns, or identities, no? Pwede siya maging locally, pwede maging national, or pwedeng international with specific or broad interest. Okay? So these are the characteristics or features defined by different authors, no? Community has common interest or characteristics, no? It interacts with one another, has a sense of unity or belonging, and functions collectively within a defined social structure to address common concern as defined by Clark of 2008. Okay. So, meron tayong mga principles of community and public health nurses wherein it has been adapted from uh, the American Nurses Association, no? Ito yung mga following principles um, na dapat ay alam at naiintindihan ng isang public health nurse, no? And again, these principles are adapted the from the American Nurses Association. Okay, so first is the focus on the community as the unit of care. Um, uh, the principle of community health public health nursing is to give priority to to community needs. No, works with the community as an equal partner of the health team. Ayan. So, lahat na yung mga activities na ginagawa natin, 'di ba? selecting appropriate activities, no? Its focus is on primary prevention. Okay, it promotes healthful physical and psychosocial environment. You reach out to all who may benefit from a specific service, and you promote optimum use of resources as well as collaboration with others working in the community. So yan yung mga principles of community and public health nursing. Okay? So again, we will go on to now assessing our community health, no? Assessing community health. So, alam naman natin na ito ang initial, di ba? Initial step when we are trying to identify na mga problems or health needs ng isang individual or ng isang group o ito sa community, we do community health assessment, no? This is an essential process for understanding the community as well as to identify nga the needs, ano ba yung mga weaknesses, ano ba yung mga assets or strengths that is useful to achieve healthy communities, okay? This is a fundamental step that supports the actions of the community health nurse in planning and implementing interventions in the community. So ito yung basis ng ating magiging planning, basis ng ating ng implementation, no, ng mga interventions na gagawin natin, as well as yung problem natin. Dito yung basis ng ating problem formulation, no. Health assessment that identifies key health needs and issues through a systematic, comprehensive data collection and analysis. No? Kaya nga tayo nagkakaroon ng mga data gathering, no? Nagkakaroon tayo ng iba-ibang mga uh, ways kung paano tayo makaka-access sa mga datas. No? And it can help in developing a community health plan by justifying how and where resources should be allocated to best meet community needs. No? Okay. So, it is also termed, no, as a community health needs assessment. Um, Yun nga, it refers to local, pwede siyang sa barangay health assessment, no? Pwede siya locally, pwedeng tribal, pwedeng buong state, no? In which yun nga, ang common goal pa rin is to identify yung key health needs and issues, no? Through a systematic process, okay? So, yung mga results ng ating assessment, sabi nga natin, makakatulong in developing a community health plan by justifying how and where resources should be allocated to best meet community needs. Okay? And then, again, yung ating datas na that needs to be collected, it depends on the objectives of community assessment. Okay? So, kaya nga tayo, di ba, yung ating data collection ay we collected it from the people or from the place, no? Do not, kasi by means of observation, no? And of course, the social system. Okay? So, okay. Yung ating uh, community database, no, for planned approach to community health or yung patch natin. Ito yung ating community health planning model based on Green's Proceed model. Okay? So kasama diyan yung mga quantitative and mga qualitative data natin na tinatawag. Okay? So ano ba yung mga kinokollect natin for patch process? So for health planning, so sa community profile, 'di ba? Uh, kino-collect natin yung community profile, yung demographic, no? The educational and then the economic data. Okay? Kaya rin tayo nakakakuha ng mga morbidity and mortality data. So kasama dyan yung mga unique health events. Okay? And then ano pa, data focusing on behavioral risk factors, no? Such as yung kanilang mga sedentary lifestyle. Okay? Like yung mga smoking, drinking, and etc. Okay? and prevailing good health practices in the community, such as halimbawa kung yung mga breastfeeding, yung breastfeeding practices, or yung mga pagkakaroon nila ng mga regular exercises. Okay? And then, of course, we get data from opinion, no? From the community leaders as well. Kasi nagkakaroon tayo ng interview, di ba, sa kanila, o in such a way na, ah, mas alam nila yung, kumbaga alam nila yung main health problem ng community, or kaya and their cause and their measures that may alleviate or correct them. Although minsan merong mga um, ah, may mga barangay leaders na kumbaga hindi sila gano'n na nagbibigay ng pansin, 'di ba, sa mga problem nila doon sa community na kinasasakupan nila. In which minsan mas nagtatanong pa sila sa mga barangay health workers natin, 'di ba? Kaya kung minsan nga 'di ba, kaya mas madami pang alam ang ating mga BHWs kasi nakaka sila yung talagang nakaka-reach out doon sa mga taong may nangangailangan, lalo na at tungkol sa health, 'no? So, although yun nga, so minsan gano'n talaga yung nangyayari. Minsan mas kumukuha ng data yung ating mga ah, barangay health board sa mga BHWs natin. Kasi nga kumbaga mas alam nila yung nangyayari, no? Okay. Next is, meron tayong mga approaches na puwedeng magamit, or siguro possible na nagamit niyo na during your duties sa community, 'no? So, meron tayong we have several ways, 'no, in conducting community assessment, 'no? So, yun nga, like what I've said, meron tayong mga approaches na appropriate, 'no, to the community, and para ah para ma-achieve natin yung purpose ng assessment natin, okay? So, first one is the comprehensive needs assessment. Ito ay it requires much time and effort, okay? Yung mga information gathered in this approach will be most useful, particularly kapag yung health assessment of a community is being done for the first time. Kasi syempre, pag first time, di ba, all necessary questions, all important questions that you need to know, itatanong na natin para maiwasan natin yung pabalik-balik natin sa community. Diba? So, lahat ng possible questions, lahat ng na sa tingin nyo ay makakatulong para makapag-formulate or para ma-identify yung health needs sila, itatanong nyo na lahat yan. Okay? So, sabi nga, periodic assessment and evaluation of health programs, ayan, may also require the application of this approach, no? So, this one is comprehensive kasi, na siya, kumbaga lahat na, no? Lahat na, kasama na yung mga tanong dyan, lahat, no? So, it gathers the information about the entire community, no? So syempre meron tayong mga systematic processes na susundin din, okay? Like yung mga questions, lahat ng mga questions, gather nyo so that, yun nga, kapag dating sa community at mag-a-assess na tayo, so maaano na natin, no? Pwede nating itanong or pwede nating pasagutan, ganyan, so that we can identify actual and potential health problems, okay? And of course, another approach is the problem oriented assessment, no? On this one naman, workable to kapag ang isang nurse ay familiar na sa community, no? Kasi why is it workable? Kasi yung may nagawa ng comprehensive community assessment, no? Kumbaga may ano ka na, may basis ka na, may data ka na. Okay? So for example, nalaman mo from the comprehensive assessment na yung catchment population pala has a large number of, halimbawa, of 0 to 5 years old. Okay? So knowing na ang mga bata on this age are susceptible to malnutrition. So, alam mo ngayon kung ano yung pwede mong gawin. Alam mo yung puwedeng strategy na, iko-conduct natin. We could conduct a nutritional assessment 'no, na puwedeng mag-focus sa feeding and dietary patterns 'no, for this age group. So, kumbaga yun nga nagkakaroon na tayo ng, basis or ng data dito sa, problem-oriented assessment at tsaka kumbaga we can strategize na, directly doon sa kanilang, problem, 'di ba? So, yun na yung tina-target kaagad natin, okay. So, that is uh, yun yung mga approaches na puwede natin magamit when it comes to assessment, okay. So, meron tayong mga, uh, tools for community assessment. Okay, we have the primary data. So, ito yung mga datas that have not been gathered before and are collected by the nurse no, through observation. So, merong mga ocular or windshield survey na tinatawag, uh, and as well as yung participant observation. Meron tayong mga surveys o meron tayong mga informant interview on which ito yata yung ginawa nyo, no, interview, community forum, as well as the focus group discussion. Okay? Pag sinabi nating a rapid observation sa isang community, it may be done through an ocular, okay, or yung windshield survey. Ito yung everyday na natin 'tong ginagawa, no? For example, kapag bago tayo sa lugar na pinuntahan natin, 'di ba, what we do is, nag-o-observe lang tayo, no? O kaya yung simpleng dumaan ka lang or kung sakay ka man sa sasakyan, kung may kotse ka man, no? So, that's the observation. Kumbaga tinitingnan mo lang kung ano ba yung meron sa community. On this community pala, they have this, may mga structures pala like this, mga ganyan, no? Dito pala sa community na 'to madaming mga bata ang naglalaro ng walang, tsinelas. Dito pala sa community na 'to madaming mga stray dogs roaming around, 'di ba? So, it gives the nurse 'no, the chance to observe people as well as, to take note of the environmental conditions and existing community facilities, okay. So, itong participant observation naman is a technique that suits common community organizing and participatory action research. Okay? Then you have the survey. Kapag there is no available information about the community or specific population group to be studied, yan. So we will, it is made up of a series of questions, no, for systematic collection of information. So for example, you want to do a survey within for example, in a group of women, no, within the reproductive of age, no, so that's 15 to 49 years old. So gustong mag-conduct ng study about them. So syempre yung mga series of question, no, then it can be in a form of written or kaya naman pwedeng oral din ang pagsusurvey natin. Okay? Um, ano pa, pag sinabi naman nating informant interview, ito naman ay purposeful talks, no? With either key informants or yung mga ordinary members of the community. No? So, kumbaga, alam nyo na. Alam nyo na kung sino yung pupuntahan nyo, alam nyo na kung sino yung kakausapin nyo. Okay? It can be consists of formal or informal community leaders as well, or persons of position and influence. No? Kagaya nga nun, kapag yung kagaya ng mga leaders natin in local government, sa school, or sa business. No? So, pwedeng, ito yung tinatawag natin ng mga informant interview. Okay? And then, community forum, ito naman, ay open meeting of the members of the community on which napakahirap i-form, 'di ba? Kapag maggagawa tayo ng community forum kasi hindi lahat ay participative, hindi lahat ay nakiki-participate lalo na kung wala silang, well, sad reality again, lalo na kung wala silang makukuhang benefit doon sa kanilang a-attendan na forum, 'di ba? Kung mamimigay ka ng libreng bigas at may grocery pack, naku, ang daming a-attend diyan, 'di ba? Pero kung wala ka naman ding ibibigay, 'di ba? Well, that's true. That's the reality, 'di ba? Lalo na yung mga ano, lalo na dun sa mga, yun nga, lalo na yung mga mas nangangailangan sana ng, forum, pero yun nga, mas gugustuhin nilang maka-receive sila ng mga gano'n. Okay, than to listen sa puwede nating i-impart sa kanila, lalo na pagdating sa health, 'di ba? Nakakalungkot. Okay, then ito naman, focus group. O ito naman ay, of course kung yung isa ay forum, ito naman ay smaller group lang, 'no? So, mag-gather ka lang ng 6 to 12 members, ayan. And then, siyempre, kung dun mo sila imi-meet, for example, sa usually kasi sa mga bigger spaces like kung may basketball court na malapit, so mag-form ka lang dun ng isang group of chairs, no? And then, siyempre, may mga mako-curious, yan. O may malalapit na din diyan, "Ano ba meron diyan? O anong pinag-uusapan?" So yan, makikisali na rin yung iba, okay. So yan yung ating mga, pag-collect natin ng mga primary datas, 'no. Okay, next naman is the tools for community assessment sa secondary data natin. Okay, sa secondary data natin ay ito naman yung mga meron ng ano, mga existing data na, 'no? Ito yung mga nakukuha, puwede na nating makuha from different, sectors like sa mga civil, registries or kaya yung mga health records and reports, 'no? Yung mga disease registries and publications, okay. So, yan. Ito yung ano lang, overview lang ng mga Registry of Vital Events. So, nagkaroon ng Act 3753, no? Nagkaroon ng Civil Register System sa Philippines. And ito, nagre-require to ng lahat ng registration ng mga civil events like birth, marriage, death, no? So, lahat yan ay kailangan mapa-enter sa civil registry system natin. Okay? And then your RA 7160, this is the local government code wherein nag-assign ng ano, assign the function of civil registration to local governments and mandated the appointment of local civil registrars. Kasi syempre, kailangan ano, um, sa bawat municipality, sa bawat regions, no, meron sila dapat na mga local civil registrar kasi napakalaki. If wala, 'di ba, sa daming tao sa Pilipinas, 'di ba, kung walang mga local civil registrar, kawawa naman, no? And then yung pinaka-central nila of course is the National Statistic Office wherein ito yung mga repository of civil registries, and then later on naging PSA na, 'di ba? Naging um, Philippine Statistics Authority na wherein 'di ba pagka kukuha tayo ng mga uh, important documents natin, ng mga individual records natin, yan, dito natin fina-file. Okay? Next, of course, is yung mga health records natin and reports which are available naman yan sa mga health centers natin. So sabi ko sa inyo, di ba, mas itong feces, malaki ang role niya. Malaki yung mahalaga siya kasi dito tayo kumukuha ng ating nagiging ng mga health statistics. Ito rin yung ginagamit ng PSA, no? To generate health statistics, and as well as ito ay tool in monitoring the health status of the population at different levels, no? This is specified by Executive Order number 352, wherein it is the official recording and reporting system of the Department of Health. Okay? So, yung lahat, kaya yung lahat ng nagiging accomplishment ng isang RHU, okay, yan lahat ay kinokolate, yung lahat ng data, kinokolate yan, and then after nyan, meron silang uh, form, no? Meron silang tool form wherein andun lahat ng accomplishments, total number of accomplishments nila per indicator yan. And then, i-enter yan doon sa ating thesis, doon sa system. Okay? And then, i-validate pa yan. Okay? Para, yun yung magiging accomplishment for example, for the month of September. Okay? Kaya mahalaga yung role ng thesis, no? Yan ay lahat ng RHU meron yan kasi yan ay it goes on the national level na, no? So diyan yung nagiging monitoring health status. Diyan nakikita kung nakaka-target ba, for example, ang isang RHU, for example, let's say, sa vaccination sa mga bata, sa NIP or sa API, na diyan nakikita kung nakaka-target ba, or ano ba yung ah, ah, ano ba yung ilan ba yung kailangan pang habulin, no, for catch up, no? So lahat kasi nandiyan, no, sa thesis na yan. Yung lahat nung nabanggit ko sa inyo na yung mga ledger or yung mga individual ah, treatment record, lahat target client list, yan, lahat dito papasok sa thesis. Lahat diyan i-enter. Diyan lahat i-encode yan. Okay? So, ito yung sinasabi ko sa inyo ng mga recording tools in thesis. The individual treatment record. Usually, kung ang isang LGU ay they are still using papers, no? So usually kapag magpapa-check up tayo sa mga uh, municipal health offices, yan, sa mga LGUs. So, bibigyan tayo ng ITR, no, ng individual treatment record, and then yan yung para magiging record natin sa kanila. But I think kasi ngayon they are working on the iClinic SIS para maging paperless na, wherein type mo lang yung name and then lalabas na rin lahat ng datas doon. No? Then, your target client list, ito yung sinasabi ko sa inyo ng mga ledgers. So, merong ledger, may TCL for prenatal, may TCL for postnatal, may TCL for NIP, for the immunization, may TCL for contraceptives, no? May TCL for adolescents, for teenage pregnant, meron din. No, madami. It's in the different form, merong red, may yellow. O yung yellow, summary table yan. Pag sa summary table naman, yung lahat ng nabibilang natin dito kay target client list ledger, nililipat lang natin dito kay summary table. Okay? Ibig sabihin, that's for the month of September. Okay? Dito kasi kay target client list ay madaming dyan. Ang mga indicators natin dyan ay, kunwari, example natin ang prenatal. Ang criteria nila under the Department of Health sa maternal and child care, ang criteria nila for pregnant women dapat ay meron silang 4 or more antenatal check-up. Okay? Kung yan ay mapa-private man or doon sa barangay, sa mga health center, naka-record yan dito sa TCL ng for pregnant. Okay? Paano po kapag ang isang babae ay meron siyang private OB-GYN? So, ang ginagawa natin dyan, once na siya ay, pero siya ay identified natin na siya ay buntis at naka-record siya dito sa TCL, dito sa health center, ang kinukuha na lang natin are the dates kung kailan siya nagpapa-check up sa private niya. Okay lang yun. No? Kasi at least may naka-record sa atin. Okay? Or paano naman po kapag walang record at nandyan lang siya. Usually kasi yun yung mga walang record na yung basta na lang dumadating sa center na manganganak na, tapos okay, basta dadating sa center, third trimester na, tsaka pala magpapatarok ng kanilang tetanus toxoid. Yan. So, yan yung mga pasaway naman. Okay? Na kapag may nangyari, hindi sila nagpapa-check up, pero pag may nangyari sa kanila, diba, malaking problema, sakit sa ulo. Kasi bakit hindi nata-track? Bakit hindi nakakapagpa-check up sa center? Siyempre. Okay? Ano pa? Diyan din sa TCL na yan, doon pa rin tayo sa pregnant TCL. Nakalagay din doon, naka-indicate din doon kung ang isang babae ay, ang isang buntis ay ah, naka-complete ng kanyang tetanus toxoid. So, kasi kapag ang isang pregnant women ay nasa second trimester niya, dapat lalo pa at ito ay first pregnancy, dapat siya ay at makadalawa ng dose ng kanyang, actually hindi na nga siya tetanus toxoid ang tawag sa community eh. TD na siya, tetanus diphtheria na. TD vaccine. Okay? So dapat makadalawa siyang dose ng kanyang TD vaccine. Paano po pagka ano na siya, meron na siya, kung nakakomplete siya ng dalawa, tapos pangatlong pregnancy na niya. So, itutuloy lang natin yon. So, ititik lang natin siya doon. May record naman na siya doon sa TCL. Ititik lang natin siya sa kanyang third dose. Okay? And then, kasama din dito sa TCL, sa pregnant pa rin, kung nabigyan ba siya ng folic and iron supplements. So, dapat ay dapat makakomplete siya ng ano ng iron and folic supplements na available sa center, no? And then aside doon, nakalagay din doon sa TCL na yun, kunwari siya ay full term na, kunwari nanganak na siya, so ilalagay pa rin natin doon kailan siya nanganak, saan siya nanganak, ano ang gender ng kanyang anak, no? Ilan ang weight ng baby, low birth weight ba yan? Normal ba yan? Cesarean delivery ba yan? Or vaginal delivery ba yan? So, nakalagay doon. No? Bukod pa doon sa ating postnatal na TCL, doon, after mo mag-update dito kay prenatal, punta ka naman ng postpartum. Okay? So, i-update mo din and then susulat mo naman kay summary table. So, ganun siya kadami. So, like, sa isang pangalan ng isang buntis at lalo pa siya nanganak, ilan yung i-fill out mo? Kung i-record mo pa yung bata, kung may data ka na ng pangalan ng bata, kung may data ka na kung babae o lalaki siya, ililipat mo naman siya sa TCL ng pang children. So, ilalagay mo naman doon, ano bang vaccine ang nabigay sa kanya sa lying-in, sa hospital, no? Kung may BCG na ba yan, kung meron ba yung vitamin K na nabigay, so lahat. So, ang isang pangalan at nanganak siya, parang ilan yung susulatan mo? Apat na ledger na ang hahaba. Di ba nakakita na kayo ng sketchpad? Di ba malapad siya? So siguro parang mga ganong kalapad na TCL. Tapos makakapal pa yung iba, no? So ganyan kalawak yung pagre-record ng mga tools and feces, in which yung mga datas na nabilang natin, na na-accomplish natin, ilalagay natin yan sa summary table, and then kay summary table, meron pa yung form, like yung mga morbidity forms na yan, i-fill out natin yan. Doon natin ilalagay yung mga total, and then yun nga, i-consolidate, and then i-validate, tsaka tapos i-encode na kay feces. For the month of September lang. So every month yan ginagawa, no? Every month ginagawa yan para na-update monthly yung ating feces. Okay? So, yun na yan, yung monthly consolidation table. And then the forms, no? May mga forms tayo na ina-accomplish. It's either yung form ay monthly, quarterly, or weekly. Okay? May mga forms tayo lagi na ina-update. Okay? Next is, okay, the disease registry naman. O, ito, another TCL din to. Or logbook or registry. O kalimitan ay ang meron niyan ay ang pulmonary tuberculosis, no, sa TB dots. Yan, dito naman sinusulat o ine-enter yung lahat ng mga newly detected cases ng PTB, no? So, meron silang pinaka parang pinaka-general registry, tapos naka-per RH pa yan, kung anong RH yung nakatira yung bagong pasyente natin ng TB, no? And mind you, those TCL are not just there na parang wala lang, okay? Yung mga TCLs na yun, dumadaan din siya sa data quality check, the DQC, wherein ah, tinitingnan, no, nagka-counter check kayo. Parang it should be counter check with the nurses kasi usually kasi midwife ang nag-accomplish niyan. And then si nurse ang magche-check niyan. I-check midwife kung tama ba yung bilang, okay? Kung may mga nawawalang mga ba't may mga kulang na bilang, yan. Kung magtatali ba kayo. So usually ano yan, nagka-counter checking. Ito naman kay disease registry, like specifically sa pulmonary tuberculosis, yan minsan ano, it's either regional or national pa yung nagdi-DQC ng mga TB registries natin. No? So, ganyan siya kalawak. Ganyan kalawak ang trabaho ng isang public health nurse. Okay, then, yung census data natin, syempre, ito naman yung mga nag-house to house, 'di ba? To get a number, no? Kung ilan ba yung nakatira sa bahay na 'yan, okay? Tapos 'di ba naglalagay pa sila ng mga stickers sa mga houses, no? Okay? So that's the census data. Okay? So I hope clear ito sa inyo. Okay. So now these are now the 8 steps, no, to community health assessment. So we have to first is to, of course, you have to identify and engages stakeholders. Okay, so sabi nga 'di ba, the nurse at saka yung mga community health needs and the community health needs assessment team, no, they identify the population group to be included in the study. So titingnan mo sino-sino ba yung pwede kong isama, anong age group ba? 0 to 5 ba? Adolescents ba? 'Di ba? Then, ito ba yung ano, pwede, tapos you will answer then, will it be the total population in the community or magfo-focus ka lang ba sa specific population group, no? For example, ang focus mo lang ay uh, yung age group lang, for example, ng mga bata 0 to 6 years old or 0 to 5 years old. Since merong high rates, no, increasing rate of dengue, since tsaka siya ay prevalent siya all over the country. So, ito yung magiging highest priority mo. Okay? So, yun nga, you identify ano, kung alin yung pwedeng age group uh, na kuhanin mo for if you want to include that in the study. Okay? Next is you define the community. Yung community ba ay rural or urban? Kung ito ay rural community, ito ba ay semi-rural o where environmental sanitation ay problem, no? Kung ito kung ito naman ay urban, so ito ba'y semi-urban community where over-congestion is overlooked. So yung mga ganung bagay yung tinitingnan natin. Okay? Then, next is the third step is to collect and analyze data. Okay? Ano ba yung mga appropriate data to be collected? Ito ba mga data na to, kailangan ba ay primary or secondary? Okay? Yung nurse and the community health needs assessment, okay, assessment team, so they will decide based on the timeliness of data, completeness, accuracy, precision, relevance, and adequacy. Okay. Next, the team now on number 4, you select priority community health issues. No, So, yung team ide-determine ano ba yung problem on a ano, which problem is of importance to the community. Okay? Um, yung level of awareness ability to reduce risk, no? Uh, are they able to do they have the ability to reduce the risk, no? How much it will cost, no? Their ability to identify the target population and availability of resources, no? Ito yung mga tinitingnan natin na para makapag-prioritize tayo ng community health issues. Okay? Then the step 5 is done through community assemble where all community health concerns are presented and how they will act on those concerns. Okay? So, after natin makapag-gather ng mga informations, no, then nakapag-prioritize tayo ng mga health issues, ipe-present natin siya through the means of meeting or yun nga, community assembly, and then lahat ipe-present natin. And ano ba yung dapat natin gawin? How are we going to act on those concerns? Okay? And then, after we document and after we communicate, okay, which we go to the sixth step is to plan improvement strategies. So, we encourage, no, or the team encourages all active community members to come together and identify strategies nang sa ganun, ma-solve yung health concern, no? As much as possible, yung lahat talaga, magkaroon dapat ng active participation, no? Para nang sa ganun nga ay mas madali natin masosolve yung mga health issues, health concerns, 'di ba? At syempre, makapag-brainstorming tayo on the different strategies kung paano natin siya maa-address. Okay? Number 7 is to implement improvement plans. So sabi nga natin, 'di ba, all community members as much as possible dapat ay ma-involve, no? Headed by their active members. Sa isang community hindi nawawala 'yan. Yung mga maaasahan mong mga individuals, no? Pag kailangan mag-gather ng tao, sila yung mga number one na nating maaasahan na sila yung nagtatawag ng mga kapitbahay nila, no? So, of course, yung team or the healthcare team naman will facilitate the implementation. Okay? And then, of course, yung number 8 natin is to evaluate progress. So, on this one naman, uh, the team and the community, no, will determine whether yung objective na naset ay na-implement ba as planned. Kumbaga, naging effective ba, nangyari ba according to what was planned. Parang ganyan. Okay? How much resources, okay? Yung time, yung money, yung effort, yung facilities na utilize pa for the execution of the plan. So that's how you evaluate the progress. Okay? So these are the 8 steps to community health assessment. Okay? Meron ba kayong questions before we proceed to another topic or another concept? Okay. So wala naman. Let's move on to the next one. Okay. Now, after assessment, of course, ang kasunod ay diagnosis, no? Ito namang pagda-diagnose, no, ay um, the process of determining the health status of the community and factors responsible for it. Okay, so ito ay the term is applied both to the process of determination to its findings, okay, by World Health. It is a quantitative qualitative description of the health of citizens and the factors influence their health. Okay. So, ang community diagnosis, it allows identification of problems and areas of improvement, thereby stimulating action. Okay? So, in this phase, yan, yung health workers, no, makes a judgment about the community's health status, resources, and health action potential. Siyempre kasi, di ba, ang health worker siya ang nag-a-assess, di ba? Siya ang nakita niya, yun dito lang din naman nag-base yung judgment niya sa kung ano yung na-assess, 'di ba? What is being assessed, doon lang din naka-based yung naging judgment niya about the community's health status, resources, and health action potential. Okay? So next is, okay, alam ko you are familiar with NANDA because gumagawa kayo ng NCP. So ito yung mga diagnostic labels natin, no? The nursing diagnostic labels. Although this one is focused on the individual rather than the community response to health conditions, meron pa din naman silang meron pa din tayong pwedeng magamit, no? With regards sa pag-formulate ng community diagnosis when at the community level. Okay? And then next is, yan. Ito kasi ay yung mga, ito. Itong community diagnosis by Schuster and Göppingen. Okay. These are mga following text, no, that explores the format, no. May mga format were proposed by Schuster and Goppinger, and as well as yung Umaha system, which later ay didiscuss natin for the community diagnosis, no. Ito yung mga formats, no, wherein pwede nating magamit sa community diagnosis. Okay. So, sabi nga, community diagnosis by Schuster and Göppingen proposed a practical adaptation of a format of nursing diagnosis for population groups. So, previously presented by Gun and Stade in 2001. So, ito daw ay may tatlong part, no? And the three parts consists of yung number one, the health risk or specific problem at which the community is exposed. Number two is the specific aggregate or community with whom the nurse will be working to deal with the risk or problem. And then the number three is the related factors that influence how the community will respond to the health risk or problem. Okay? So, yung relationship ng people and environmental factors, no, it influences the health action potential positively or kaya naman negatively. So when the people, no, have a pervasive feeling of community belongingness, okay, nagkakaroon na ng mga common perspective of health risk posed by a community condition, and as well as yung mga skills to recognize and deal with a community problem. Okay? And of course, yung pag ganun yung nangyari, the potential for community health action is greatly increased. No? Ibig sabihin, kapag ang mga tao sa community, they have this feeling na of belongingness, they share common perspective, no? And they have the skills na to recognize and deal with community problem. So mataas yung potential na yung pag-response nila, no, sa mga community health issues ay mataas din, no, is greatly increased. Okay? However, yun nga, yung may mga nagkakaroon tayo ng mga environmental factors that exert din a positive effect on community health action potential. So, kapag meron silang accessibility sa mga resources, yan, o kaya naman ay malaki yung naitutulong ng mga environmental factors natin. Therefore, magkakaroon ng positive effect yan sa community health action. Okay? So, sa Umaha system naman, on this system, ito ay framework, no, for the care of individuals, families, and communities by any of the following: by nurses, nursing educators, physicians, and other healthcare providers. Okay? So, on which, ito yung um, ito yung yung actual na nangyayari, di ba? Wherein yung mga individuals are being given, being cared by the nurses, no? Yung pag-avail nila ng mga iba-ibang mga services, no? So ito ay comprehensive and research-based classification system for client problems that exists in the public domain. Meaning, yun nga, it is not held under copyright. Okay? So, meron tayong tatlong classification on this system. And na pwede nating magamit together. So, first is the problem classification scheme, the intervention scheme, and then the problem rating scale for outcomes. Okay? So, ito yung tinatawag natin na mga schemes. Okay? Yung tatlong component ng UMAHA system. So, we have the problem classification scheme, which is the client assessment. Ito yung, this serves as a guide in collecting, classifying, as well as analyzing and documenting the and communicating health and health-related needs and strengths. Okay? Yung it provides a model for practice, for education and research. Okay, so the identified problems or areas or concern are classified into 4 levels, and these are the 4 levels. Okay, the first and most general level of classification is composed of 4 domains. So, meron tayong environmental, meron tayong psychosocial, physiologic, and then health-related behavior. Okay? So, the second level naman consists of the problems or areas or concern under the 4 domains. So, ano ba yung mga areas or concerns natin under these 4? So, the first one is yung environmental. So, under environmental, ano ba yung nandyan? Yung mga material resources, okay? Mga physical surroundings, both inside and out the living area, the neighborhood, no? Broader community income, yan, sanitation, residence, neighborhood, workplace, and safety. Okay? Then, sa psychosocial domain naman, under psychosocial, malawak din siya kasi yung mga patterns of behavior, emotion, communication, relationship, development, yan. Malawak yung scope niya. Sa communication with community resources, okay? Sexuality, social contact, role change, yan. Then interpersonal relationship, you also have spirituality, growth and development, so grief, mental health, caretaking and parenting, neglect and abuse, no? It goes under the psychosocial. While your physiological ay ito naman yung functions and processes that maintain life. So ito yung ating mga senses, no? Speech, language, yan. Oral health, cognition, pain. Kasama na rin po dyan yung ating mga different systems, no? Ng katawan, different functions ng different system ng katawan natin. Okay? So that would fall under the physiological. While your health-related behavior, so ito naman yung mga patterns of activity that maintain or promote wellness, promote recovery, and decrease the risk of disease, no? Kasama dyan yung mga nutrition, sleep, rest patterns, ayan, mga physical activity, and so on and so forth. Okay? So, yan yung ating second level. Then, the third level, ito naman ay the area of concern is qualified according to 2 sets of qualifiers naman. So, meron tayong the first one is the area of concern ay categorized siya into health promotion, categorized into potential problem or actual problem. While your second is the level of clientele involved, no, is identified. So, ano ba yung ating clients dito? Or is it an individual, a family, or community? Okay. Then the fourth one, under this problem classification scheme is, the fourth and the most specific level is made up of clusters of signs and symptoms that describe actual problems, no? So, yun nga, kapag nagkakaroon na halimbawa ng mga signs and symptoms, no, na pwedeng makapag-describe dun sa actual problem, so, ano rin yan, most specific level daw, okay? While the first one is the most general level, okay? Alright, so next, Ayan. After this client assessment or this problem classification scheme, ay, wait lang ha. Okay. We will move on. We will now go to the planning. Yan. So, planning na. So, planning community health interventions. So, ito naman, ang planning, it involves priority setting naman tayo. No? So, nagpo-formulate tayo ng mga goals and objectives, and as well as we identify community interventions. Okay? So, this one, no, planning for community health intervention ay based, sabi natin kanina, based on the findings during assessment wherein and at saka doon sa formulated nursing diagnosis. So doon nakabase yung planning natin. So this is a logical process of decision making to determine which of the identified health concerns requires more immediate consideration. Alin ba dun sa mga na-identify natin ang kailangan ng agad-agarang solution, agad-agarang consideration, no? Nang sa ganun ay para ma-achieve natin yung goals and objectives natin. Okay? So, sa planning, meron din tayong mga criteria to decide, no, on a community health concern for intervention. So, we have, that's according to World Health, no, nag-set sila ng guidelines or ng criteria. Kasi, sa dami ng pwedeng maging identified community health concern, no, you cannot deal with all of it at once, 'di ba? Ang daming pwedeng maging problem na mag-arise sa isang community. Again, hindi natin sila kayang i-solve all at once. Kaya kailangan natin mag-prioritize, kailangan natin mag priority setting. Okay? Yung mga step na to, it provides the nurse and the health team with a logical means of establishing priority among the identified health concerns. Alin ba yung number one? Ano ba yung number two? Ano ba yung hindi na makakapaghintay? Alin ba yung pwede pang maghintay? Delay lang muna ng konti. Okay? So, kaya yun, sabi ko nga, na kapag nag-set ng suggested criteria ang World Health, no, to decide on a community health concern for intervention. So the first one is yung significance ng problem. Okay? Yan ba ay based on the number of people in the community affected by the problem in the community, affected by the problem, okay, in the community, affected by the problem or condition, okay? Yun ba yung o kung halimbawa kung ang concern mo ay about the disease condition. So, kailangan this may be estimated in terms of its prevalence rate. Dapat alam mo kung ano ba ang prevalence rate ng isang sakit. Okay? Kung ang concern mo naman ay potential problem pa lang, meaning wala pang hindi pa nade-develop yung certain condition. So, its significance is to determine by estimating the number of people at risk, for example, of developing a certain condition. So, for example, potential problem ng isang tao, ng community, ano ba yung potential? Pwede maging potential problem nila, for example, ay tuberculosis, okay, PTB. So, ilan yung mga estimated number of people mo at risk para ma-develop yung ganitong condition. Okay? Then, number 2 is the community awareness. Okay? Siyempre, kapag ang mga tao sa community, if they are aware of the risk arising from a condition pervasive in the community, yan, they are likely to have motivation to deal with the condition and mabibigyan nila ito ng priority, no? Kung sa tingin nila yung isang problema ay let's say for example uh, yung poor, for example, yung kanilang uh, wala silang yung potability of water nila, no, ay very poor, no? Which can lead to certain diseases. Pwede magkaroon ng amoebiasis, pwede magkaroon ng diarrhea, no? Kung aware sila doon, therefore, they will do, no, they will do some actions in order for them na mabigyan ng priority yung problema nila yun about water, no? About water potability. Okay? Mamomotivate sila ngayon na ah, gumawa ah, ng mga strategies or ng mga actions nang sa ganun makaiwas sila doon sa ah, mga ganong conditions, no? So you create awareness, no, to the people of the community. Okay. Next is the ability to reduce risk. So ito naman, this criteria naman, this is also involves, no, the health team's level of influence in decision making, no? Uh, Tinitingnan natin, do they have the ability, no, to reduce the risk of a certain health concern? For example, yung kanilang mga actions, no? Uh, yung actions in resolving a community health concern, does it help, no, to reduce the problem, to resolve the problem, no? Do they have the ability to influence the people in the community? Okay? So ano ba yung pwede nilang gawin? Okay? Then, number 4 is the uh, cost of reducing risk. So, kailangan i-consider din ng nurse, no, yung economic, yung social, yung ethical requisites, and consequences of planned action, no? So, sabi nga natin, di ba, hindi magwo-work sa lahat yung pwedeng maging strategy mo kasi meron ka dapat mga i-consider. Diba? So you have to consider din yung economic, yung social, and the ethical requisites. Okay? And then, number 5 is the ability to identify the target population for the intervention. No? For the intervention, it's a matter of availability of data resources. No? Paano ba tayo identify ng ating mga target population? So, pwede naman dami tayong mga data sources, di ba? Your feces, nandiyan yung census, survey reports, okay? Or yung mga, iba-iba pang mga tools din, no? Then, availability of resources. Yan, of course. It is to, intervene in the reduction of risk entails technological, financial, and other material resources of the community, okay? Na pwedeng ma-utilize, no? Pwede ring magamit. Okay? So these are the criteria or the criteria on planning, no? Criteria to decide on a community health concern for interventions. Okay? Next, after that is dito pa rin tayo sa planning. Okay? Sabi dyan ay later on may example why may mga scale of 1 to 10 yan. Okay? So, para magkaroon tayo ng realistic and useful outcome, 'di ba? Yung priority setting natin process, okay? It requires the joint effort of the community, of the nurse, and other stakeholders, okay? Or tinatawag natin na group, health team group, no? So, itong group na to, no, the group defines guidelines for discussion, particularly on the manner of reconciling the differences of opinion. Diba? Siyempre sa ibang group, diba? Iba-ibang opinion, iba-iba ang perspective ng mga members of the group. Therefore, Schuster and Gopinger again of 2004, they had this suggested what you call the flexible process, no? They use a nominal group technique wherein each group member will be having an equal voice in the decision making para maiwasan natin yung pagkakaroon ng mga avoiding the control of the process by the more dominant member of the group. Diba minsan di nawawala sa group yan yung kapag ikaw na lang ng ikaw, yung nagsasalita, ang nangyayari yung mga members parang, o di sige, we will just consider kung ano yung sinadjust mo, kung ano yung sinasabi mo, yun na lang yun. Diba? Okay? So, ano pa? Yun nga, this technique, no, this one is appropriate for brainstorming and kapag magra-rank tayo ng mga ideas. And kapag may mga nabuo na tayo mga consensus, yan. When consensus building is desired over making a choice based on the opinion of the majority. Okay? So, meron tayong yung group, they would make a list of identified community health problems or conditions, no? So, yung each of the identified problems, yan ay separately treated according to a set of criteria agreed upon by the group. So, merong mga set of criterias na um, set of criterias wherein na formulate din naman ng group, and then dun malalaman kung ano yung pwedeng nilang maging priority dun sa problema. Okay, let's have this example. Okay, so we assign criterion weight through nominal group techniques. Okay, assigning criterion weight. So on this one, ang problem natin ay risk of maternal complications leading to maternal mortality in Barangay Bagong Silang. The question is, how important is the criterion in solving the problem? Okay? So, magsiset tayo ngayon from scale of 1 to 10, diba? 1 is being the lowest. So, magbibigay ng uh, uh, magbibigay sila ng iba-ibang uh, criterion, okay? A weight based on their perception. So, for example, si Nurse Bell, ang dito, ang criterion is the significance of the problem, community awareness, okay? So, si Nurse Bell, nagbigay siya ng 8 sa significance of the problem. Si midwife, nagbigay ng 10. Ang BHW, nagbigay ng 7. And then the members of the community, nagbigay ng 10, nagbigay ng 6. Then you will get the average weight. Okay? And so on down, no? So on down to the availability of resources. So, bibigyan mo sila ng rate. Okay? Then, another problem naman, another problem. Kumbaga, kada problem, no, gagawa natin ng ganito, no? Kumbaga, i-rate natin siya. So, ang question naman dito, ang problem dito ay, can the group influence, no, the situation in relation to the criteria? So, same group members, same ang criterion, then you wait, then you get the average weight. Okay? And then, to get the average weight, yan, from step 1 and ratings from step 2, no? Ayan, pinagsama, the criterion weight and the criterion rating. So, times weight times the rating, so you get a 48. So, total priority score of problem. And then, syempre, hindi lang naman dalawa, yung iba pa mga problems. And then, from here, sa total score ng problem, dun kayo makakapag-prioritize ng dapat yung unahin ng mga dapat i-address ng mga problems. Okay? I hope this is clear sa inyo. Anyway, ito naman ay pinakita ko lang sa inyo kung yung priority setting. No? Okay. Next. Okay. Formulating goals and objectives. Yan. In family health nursing, no, yung goals are the desired outcomes at the end of the interventions. Whereas yung objectives, ito yung mga short-term changes in the community that are observed as the health team and the community work towards the attainment of goals, no? Yung objectives natin, it serves as instructions, no? Defining what should be detected in the community as interventions are being implemented, no? It should be smart, no? Should be specific, should be attainable, and time-bound. So, dapat yun yung paggawa natin ng objectives para alam lang natin kung ano yung mga magiging direction natin. Alam natin kung kung naka-align ba yung mga actions natin doon base doon sa ating mga nagawaan na formulate na goals and objectives, no? So this is the sample goal and objectives of a community health plan. So yung problem is the risk of maternal complications leading to maternal mortality in Barangay Bagong Silang. Okay? This data is based on the statistics of one of the Philippine regions and provinces as seen in the 2008 Physis report. Okay? So, kita nyo, sa physics talaga kumukuha ng data when it comes to the statistics. Okay? So, the goal is to reduce maternal mortality rate from 132 per 100,000 live births to 80 per 100,000 live births by the year of 2015. So, ang objective natin at sabi, short-term changes, di ba? So, at the end of the year, the community of barangay will, yan, iba-iba na yung nandyan. Okay? Again, according dapat doon sa, naka-align dapat doon sa goal. Okay? As well, syempre doon sa problem, diba? Para alam natin. Para makapag-set tayo ng goal, makapag-set ng objectives. Okay? So that's the sample of your goal and objectives of a community health plan. And then, okay, on this one, now, we go on to deciding on community interventions action plan. Okay? Sabi natin kanina, kapag tayo ay gagawa ng mga plans or kapag meron tayong mga gagawin, madami tayong dapat na i-consider. Okay? The group takes into consideration the demographic, the psychological, social, cultural, and economic characteristics of the target population on one hand, and then ano ba yung available resources naman on the other hand, no? Kasi nga of the differences na meron ang mga individuals or ang isang community, okay, what may work for one community may not be effective in another. Okay? So the group ngayon will analyze, no, so the group analyzes the reasons for people's health behavior and direct strategies to respond to the underlying causes. So for example, reasons for preference of home delivery over facility-based delivery should be identified. Ngayon, if the majority of the women would choose to have a home delivery because of cost or lack of access of birthing facilities, so dapat mayroong mga strategies. No, strategies should then be focused on improving facility-based services. Okay? Kung ang primary reason mo naman is sociocultural, therefore the planning team may opt to concentrate on providing opportunities for skills or development of traditional birth attendants or existing effort to gain the trust and confidence of the women and their families. No? So that's how you decide doon sa ating mga community interventions. So hindi tayo nagiging biased, no? Kasi dapat we will take into consideration of different factors, okay? Then after that is the implementing community health interventions. Ito naman ay also referred as action phase, no? Ito yung sabi nga, ito daw yung most exciting phase daw to for most healthcare most health workers, no? So aside from being able to deal with the recognized priority health concern, yan, the entire process is intended to enhance the community's capability in dealing with common health conditions or problems, no? We empower kaya nga 'di ba, we empower the community, no? We let them uh, kumbaga hinahayaan natin sila na mag-participate din talaga sa atin. Actually, we encourage them talaga na mag-participate sila so that alam nila kung paano ma-address, no, kapag sila na yung nandun lang sa community, no, in dealing with different health conditions or problems, no. So the nurse's role therefore may be to facilitate the process rather than directly implement the planned interventions, no. The nurse's role therefore may be to is to help the process, to help with the process, no, rather than mag-direct to implement on the planned interventions. Okay? So implementations no, entails coordination of the plan with the community and other members of the health team. So syempre, kapag meron tayong gustong i-implement, no, meron dapat na makikipag-coordinate din tayo dapat sa mga ano, doon sa mga tao sa community as well as doon sa iba pang mga members of the health team. Okay? Um, dapat maintindihan nila no, yung goal, yung objective, yung planned intervention. Okay? And magkakaroon kasi din ng mga collaboration with other sectors. No? Pag nagkaroon na ng, sige, nag-come up na sa isang goal, objective, or planned interventions, ayan. So, there would be collaboration with other sectors na, no? Such as the local government and other agencies, no? If necessary. Okay. So, then will be the evaluation. Yan. Yay, patapos na tayo. Kasi mag-evaluate na tayo. Okay. So, sa evaluation naman, this involves looking into the manpower. Okay? And meron tayong mga approaches no that may be directed towards structure, process, or outcome. Okay? So meron din tayong tinatawag na ongoing evaluation or monitoring. Ito naman done during the implementation so that makapag-provide ng feedback on compliance to the plan as well as on need for changes in the plan to improve process and outcomes of interventions. Okay? Tinatawag natin siyang ongoing. Ibig sabihin, during the implementation, meron ng nag evaluate para alam na kaagad natin, no? Para ma-improve kung meron ba tayong dapat na mga baguhin, no? Or ano ba yung mga dapat ano pa yung mga changes na pwede. Okay? So you have the structure evaluation. Okay? This one involves looking into the manpower and physical resources of the agency responsible for community health interventions. So ito yung ang in-evaluate syempre yung mga tao na nag-execute no ng mga or yung mga agencies no nag-execute ng ganitong ng activity for example no yung mga physical resources natin responsible for community health interventions ayan okay. Next is the process. Ito naman yung examining the manner by which assessment o yung ADPI natin were undertaken. Ibig sabihin, nagawa ba? Na-execute ba ng maayos? Aligned ba sila altogether? Diba? Are they aligned with each other? Ayan, okay? Then, outcome, of course, you determine the degree of attainment of goals and objectives. Yung objective, yung goal ba natin, are they met? Partially met ba? Or unmet ba? No? So, ini-evaluate natin yung outcome natin kung na-achieve ba natin yung ating goals or objectives, no? Okay. Do you have any questions? Okay, wala naman. Sige, let's have last na to. I'll show you a clinical example. Okay, who wants to read on this one? Clinical example. Sige, Miss Zarifa. Ikaw na una. Go ahead.
Sige po. So, clinical example. Francis is a public health nurse from the Rural Health Unit 2 of the municipality of Plaridel in Bulacan. He was assigned to Barangay Sipat Health Station. During the first 6 months of his stay in the community, he noticed that animal bites among children are a common problem encountered weekly in the clinic. He checked the record for the past years and realized that it has been a perennial concern of the barangay.
Okay. So ito yung ating situation, no? Si Nurse Francis, public health nurse, okay? And then na-assign siya sa Barangay Sipat, okay, health station. So during yung 6 month stay niya, okay, may mga napansin siya like yung mga animal bites among children ay very common, okay? Kasi Yun yung mga na-encounter niya weekly. Okay, so um, then later on, dahil nga na-observe niya na ganito, nagkaroon siya na idea, no, to check the record for the past years. And ano to, ito na yung talang palagian ng concern ng barangay. Okay? So, we will now determine, no? We will assess, we will formulate a diagnosis. Okay? So, ngayon nga, sabi nga natin, di ba, so si nurse, he decided to conduct a windshield survey in the community, no? Then, sinundan pa ng followed, ng home visit, no? Siyempre, accompanied by BHWs yan. So, napansin niya, no, upon assessment ng kanyang rapid observation or ng windshield survey, ay madami mga stray dogs na gumagala, no? Freely roaming around in the streets and cats are left attended. Okay. In the afternoon, nakita niya yung mga bata, ay madaming bata naglalaro sa street, okay? And nagkakaroon sila ng interaction with the stray animals, okay? So, the nurse, considering the presence of the problem, no, ngayon, humingi siya ng advices from the purok leaders of the barangay. Okay? Pumunta siya, and then, he conducted a focus group discussion. So, and then after that, so during the session, no, attended by 6 participants lang, kasi nga siya ay focus group, no, nilatag niya lahat ngayon, yung problem. And which implies an immediate, an urgent concern to. So, according sa nalaman niya, according to the Purok leaders, no, apart from the cost and anxiety of having a member of the family who suffer an animal bite, meron silang problem din when it comes to the access to anti-rabies injections, no. So, therefore, dahil nakita ni Nurse Francis na ito talaga yung pinaka concern ng community, no? Pumunta na nga siya ngayon to the other level, to the upper level, which are the local leaders of the barangay officials, 'di ba? Okay? So ngayon, nagkaroon ngayon ng uh, after asking for assistance, okay, assuming na siya ay nabigyan pansin at nabigyan siya ng assistance, okay, nagkaroon ngayon ng community assembly. Okay, nang sa ganun, magkaroon ng mga suggestions, yung mga tao, no, kung paano ba maa-address yung problem na to. Okay, they ask for suggestions, no, and then, this forum, okay, nagkaroon na ng forum, okay, attended by more than half of the residents. So the people pointed out the need to foster an attitude of responsible pet ownership in the neighborhood. Okay. So after nun, a plan uh, was then crafted, no? The highlights, nagkaroon din ng mga collaboration among the stakeholders, okay? Therefore, yung community, no, identified resources, no? Resources they can avail to solve this issue, okay? And then, after ng planning, ayan na, nagkaroon na ng implementation, no? So after 3 months of coordinating with various agencies, the community implemented the following. Nagkaroon na ng mga barangay ordinance, nagkaroon na ng mga monthly health education regarding sa mga regarding rabies, okay? Para magkaroon ng awareness, okay, in the community. Nagkaroon ng quarterly rabies vaccination for household pets, yan. Okay? And then, yun, nagkaroon tayo ng mga and the last, yung na-establish yung referral system, no, from the municipal health office of the town to the provincial, okay, for anti-rabies shots for victim, no? Then, after implementation, syempre, of course, magkakaroon tayo ng evaluation. So, after 6 months, ayan, ano yung naging outcome, no? a significant reduction, yan, nagkaroon ng pagbabago na bumaba na yung cases of animal bites nila doon sa community. No? It has been documented and people in the community showed compliance. So, ibig sabihin lahat ay sumunod doon sa local ordinance on responsible pet ownership. And that ends our discussion for the community, for the nursing process in the community. Okay, do you have any questions? Kaya nyo nang gumawa ng community health plan. Oh, oo, ganyan din yung reaction nila kanina sa akin. Anyway, I will further discuss, no, with regards sa inyong activity na yan. Um, ang good news naman diyan ay it will be ano naman, per group naman yan. Not unless gusto niyo individual. Puwede din namang individual. Okay. Hindi, per group yan, per group. Oo, alam kong ayaw niyo yan. Ayaw niyo yan. Na kayo ay mag-individual ng activity. Siyempre, dun lagi tayo sa masaya. At gusto niyo lagi per group. 'Di ba? Oh, yeah. So, uh, you will I will ask you to make kaya sabi ko 'di ba, yung datas that you get from your community duty ay i-keep niyo lang kasi possible na baka yun ganyan na din yung gamitin natin. And since mahirap nga siyang individualize kasi siyempre pupunta pa kayo sa mga communities, no, to get some datas. So, kaya nag-per group na lang din tayo. And of course, i-discuss ko naman yan sa inyo after na lang siguro ng midterms with regards doon sa inyong activity. But at least, nabigyan ko lang kayo ng overview of your activity. Okay? At syempre, dadagdagan pa natin yan. Naku, ang mga reactions. Okay. Ilan kayo in one group?
For community duty po ba?
Yes, yes.
4 members po per group and then may
Ah,
isang group po na 3
na
members din po.
okay. Sige, sige. Okay. Oo, we will just use na lang din the same group on your duty. Okay? Para kasi 'di ba, yun na yung ano nyo, ah, yung mga datas nyo kasi 'di ba, para hindi na maghiwa-hiwalay pa. Okay? So, any questions pa po? Or concerns that you want to raise? Kung wala naman na, so, oh yes, go ahead, Mr. Donceras.
Wait lang, audible po ba?
Yes, yes, you are.
Yes. Good evening po. Ma'am, ask ko lang po. Yung further details naman po, magigit na naman po after. Yung about po sa activity. Yun po
Ay,
yung after midterms pa naman po. Ano?
yes, yes, of course. Oo naman. After
Okay po.
midterms yan,
Thank you
guys.
po.
Oo. Oo, para
Okay.
maka-ano muna kayo, maka-focus muna kayo sa midterm exam.
Okay po.
Okay.
Ask ko lang din po about po
Yes.
din. So, medyo maingay lang.
Okay lang.
May bisita po. Ask ko lang po ma'am about po dun sa discussion po. Sa evaluation process po. If po
Mm.
mag-evaluate po tayo and ipuput natin po into paper, ang in-evaluate po ba dun sa structure is yung renderers po or yung healthcare providers po? Kasi
Yung
may approach po dun na structure po. Structure evaluation po.
wait lang ha. Ang sabi kasi doon ay yung ating yung ating healthcare teams, 'di ba? Wait lang. Yes. Kasi 'di ba, tayo yung responsible for community health interventions, no? So, yung structure evaluation, looking into the manpower. So, ito yan, yung tayo yan, yung ini-evaluate dyan, sa structure evaluation na yan.
Okay po ma'am. Noted po. Thank you po.
Okay, alright. Sige. Any concerns pa po? Okay, PPTs will be sent Give me time until kung okey lang sa inyo mag-send